couple ground rules before we get started, particularly since we are doing this virtually, is please remember to mute your microphone unless you're ready to speak. We kindly ask everyone to silence their cell phones, and when you'd like to share your thoughts and questions, the best way to do that is probably to raise your hand on Zoom. Sabrina Vieira, our technical and director at technical support and director, is here to 12 different locations. In addition to that, our medical students routinely go to between 50 and 60 countries a year to study as well. And we have global health training programs where we bring international faculty, physicians, and students.
Animal interactions, climate interactions are significantly involved in health and wellness. Which leads me to the second thought, and that is that I'm Dean of the College of Osteopathic Medicine. I'm representing a college that's now over 52 years old at Michigan State. But the profession, the osteopathic profession, is about 130 years old. And from those earliest days, it espoused a holistic view to health and wellness. That we don't just reduce people down to a problem or a symptom, but we look at an individual holistically. We look at their systems, their organ systems, their individual self, their interactions with the family, their interactions with the community, and beyond that, environment, etc. This has been a primary tenet of the profession since day one. And if you think about 130 years ago, that being a primary tenet was pretty progressive for them.
You know, when I started diving into One Health several years ago, it was hard to find One Health education experiences and where to go to learn more about it. And the landscape has changed tremendously, I'm happy to say. So I just wanted to talk a little bit. We're going to kind of do a quick look at different opportunities that are out there. And we're going to go from actually K through 12 on up through professional studies. So one thing I really want you to take a look at is this website. So this is the One Health Commission. And this is managed by Dr. Cheryl Stroud, who's a veterinarian. And she has slowly over the years just kept plugging away, and now this site and this organization has really taken off. But this is a source for incredible resources. It's really well organized, and it's dependent on people uploading their information. For student groups to upload and use this as an organization, there's educational resources on here. There's new events, legislative updates. There's a new update.
In this Global One Health Congress. And we have to think globally, but act locally. And one size does not fit for all. So that's why it is contextual that we have to understand in terms of One Health. Thank you very much.
And I couldn't cut slides. I think I will bring for previous pictures. And then my degree is actually, I have a PhD in environmental health sciences from the University of Michigan, all on human diseases, and then switched to beauty diseases for my postdoc. And a lot of people ask about how that works, but it's actually a very easy transition. It's populations, and they have a lot of the same environmental risks that we do, and so a lot of the same skill sets work. But today, I was given a very broad topic about pollinators, food safety, climate change. I'm going to introduce them quickly, and we'll happily talk about bees at length to anybody at any time if they want to talk more. So the first thing is, why do we care and why is it relevant? And it's because we need plants, so we need ecosystems and trees. And they're the basis of healthy ecosystems. And if you go back to 6th grade ecology class or biology, remember these food webs, and at the bottom is plants, but in reality what you don't see along this bottom line is that it is really pollinators making that happen. And that is because plants need pollinators in order to reproduce. So they can't go to the bar and find another mate. They have to share genetic material by having something moving that material between them. And this process has gone on as long as we've had flying insects and plants develop flowers. And this is
presentation will be focusing on that only. So it's an opportunity to share this project overview here, this being the One Health Day. Like other part of the world, Mekong regions also faces several challenges. That includes rapid socioeconomic changes, like climatic changes, agricultural intensification, urbanizations, natural habitat alteration, and biodiversity loss, vector and waterborne diseases. For example, dengue is one of the major threats happening in Mekong region. And there are also incidences of drug-resistant malaria. I will be discussing with Dr. Maid Walker, who is a professor in anthropology department yesterday. And he told me that in fact antimicrobial resistance, it was when the pressing wave it started with the Mekong region, but it was completely. So there are, besides those infectious diseases, there are incidences of several non-communicable diseases as well affecting this region. Despite these challenges, despite these issues, there are several challenges facing these regions. There are not enough surveillance done, research done, as well as there is human capacity shortages, and also education and trainings are lacking, and education research and outreach linkages also we can see disconnect. Not
And when you look at these infections, the majority of them are actually spread because of contaminated food and water. And so I'm going to be focusing on foodborne pathogens, but a lot of the pathogens that we actually study can go both ways. They can survive in water systems as well. So there's some crossover. According to the WHO, the burden of foodborne disease is quite substantial globally. And so every year, about 1 in 10 individuals will get sick, contributing to about 33 million life years lost. And it can also be deadly in that we see about 420,000 deaths, and most of these are in children. So when you look at the totality of these infections, at least in the US, about 3.6 million of the 9.4 million that were detected are caused by bacterial pathogens. So we also know that antibiotic resistance is a major concern among many of these foodborne pathogens, and I've indicated 3 here, and these 3 I'm working on in my lab. We're studying the epidemiology, pathogenesis, and evolution of these pathogens, but they've been named by the CDC as serious public health threats. And that's mainly because we see high frequencies of resistance in these pathogens. And so the CDC estimates that each year, antibiotic-resistant bacteria and fungi can cause up to 2 million infections and about 35,000 deaths. And so we know that we can't get rid of antibiotics entirely, but they're actually critical. They're critical for treating infections in both humans and animals. And so we do know that based on some epidemiological studies, that resistant infections can contribute to longer hospital stays. A lot of times their patients are getting treated with the wrong drugs. And so that kind of selects for the pathogen that might be resistant. and allows that to proliferate in the system. And so many times that will increase the likelihood of death and contribute to greater medical costs. We also know, based on some data showed previously, that the global use of antibiotics has been increasing, and we see the greatest increases in the developing countries. From the food safety perspective, I like this figure because it kind of highlights the problem, at least from the animal side. And so, let's see, I don't know if you can you see my mouse? Okay, well, we'll just start at the top. So you can see the livestock and the animals. They have these little dots inside their gut. Those are the bacterial populations. And so those bacterial populations might be pests, in some cases pathogens, or they're typically mostly commensal populations. And so when antibiotics are given, those are going to select for those microbial populations that possess antibiotic resistance genes and wipe out the ones that are susceptible. And so you can see here, the antibiotics will kill off those susceptible populations, allowing the resistant ones to proliferate. And so therein lies the problem. We see spread of these resistant populations in animal products, produce that might get contaminated with irrigation systems, water, as well as soil. And so then when you bring these food items home, you might get cross-contamination on your work surfaces. And of course, you then get dissemination into the environment through defecation from colonized animals. And then the exposure, of course, happens when you're in contact with the contaminated food or in contact with the contaminated
University. We look at everything we do, just everything we've talked about today. Climate change impacts all of this. And I also want to thank you for the opportunity to be here this morning, because even though number one is it's a great opportunity to get out of the office and do some science. So, but I do think it's very, very helpful for people in jobs like mine to get out and listen and to hear what people are talking about. If we're going to help you build innovative teams and do things to support your work, I think it is important to have a good idea of what's going on. And also certainly want to express the support of the research, the Office of Research and Innovation, and particularly Vice President Gage, for the work that you're doing. When you look at an institution like MSU with the comprehensive nature of the university and our low boundaries, I like to think that this institution is as well or better situated to attack some of these big complex problems as anybody in the world. And then you combine that with the incredible international connections that we have, from health to agriculture to natural resource and all of these things. Really, I think kind of the challenge of my work and really the opportunity of that is how do we bring people together in innovative ways. And again, this is part of the reason why we're very interested in these types of seed grants to help you. Sometimes small money with flexibility and speed is sometimes more useful than big money. Of course, I know you all want big money, but when you need help with little things, for example, the example that Bill gave, for a very modest amount of money, they were able to bring together very quickly a very large group of people that are now talking about all sorts of different ideas coming together in innovative ways, because we're not going to attack these problems like many of them that we heard today by doing things in a traditional way. It's just really not going to happen. And again, I think MSU is really well suited to do that. And so certainly we're all, we've been through a strategic planning process. And if you look at the pillars of the strategic plan, this type of work fits very, very well within that strategic plan. And when you look at the research goal of discovery, creativity, and innovation for excellence and global impact and sustainable global health, it's not what we've been talking about all morning. I mean, it just lines up so well. So again, I think we're very well suited to continue to do those types of things. And I've already mentioned, but I think I want to stress it again, is we need to then weave these long-term international partnerships and connections that we have to really make strong impacts. And we're here talking about some fairly specific area today, but this, goes through all the things we do. You talked earlier about Dr. Carrie Taylor and her work. Well, she's now working with entomologists and some things like that to build and understand some of these systems and how all these things fit together. And it's really, I think, those kind of things that can make this institution unique and really allow us to continue to advance. And some would say that the land-grant model is dated. I would say it's more relevant. It's relevant now as it's ever been. We're just addressing different problems and different things that we were 150 years ago or so when it was created. So it's really good to see us coming back together. I hope we can continue to have more and more of the in-person activities. I think we're all sick of being locked down and staring at a computer screen. So it's great to see folks here today. As many of you are aware, some of you have attended some of the events. The Office of Research and Innovation is making a particular effort to not only organize some of our own events, but also to support events from other groups in campus. Our convening around climate change last spring was a big kind of a beginning event around climate change, but we're also now doing more focused events, again, to try to bring people together with the idea of building teams and working together and to address these really complicated global problems. So again, one of the things that we're trying to do, and certainly that we hear, and you hear more and more as we listen to the faculty, is that we really need to do our best to try to reduce the barriers and try to make it as easy as we can for all of you to do your work. As we expect more and more complex grants, more partners, more subcontracts, we've got to continue to work to make sure that we can try to present or provide some of the type of administrative help in terms of grant support. Recently added another person in our office to help with developing grants. I think we need to do more of that. I think we need to work to mentor our younger faculty to help them build these types of relationships and partnerships into their careers as they move forward. And so it's integrated into the programs that they need to develop and to be successful in the academy. So again, I want to invite all of you to continue to think about these things and let us know if there's anything that we can do in the Office of Research and Innovation to help advance these types of initiatives. We don't have a lot of money, but we're going to do the best we can to invest the money that we have in innovative ways. And if we are successful, it helps us generate more money that we can reinvest in ways. So again, thanks for the opportunity to be here this morning. I really enjoyed being able to sit here and listen, learn some things, took some notes, and we'll continue to move forward from there. So again, Bill, thanks to you and the group for the work that you're doing, and I wish you all the best as we move forward. So thanks.